I am Dr. Janardhan Rao. I am one of the senior consultants in the Department of ENT at KIMS Hospital. Today I would be talking on hearing impairment or hearing loss. As all of you know, ear is one of the 5 sensory organs in the body and it helps us to perceive the sound. Hearing impairment or hearing loss is the term used when you lose either part or all of the hearing ability. Other terms used to describe this are deafness or hard of hearing. Hearing impairment is classified in terms of severity of hearing loss as well as the types of hearing loss. We call a hearing loss conductive hearing loss when the defect is in the outer and the middle ear. If the defect is in the inner ear or the cochlea and the nerve connecting the ear and the brain, then the type of hearing loss is called sensory neural hearing loss. The conductive hearing loss occurs when there is a problem with conduction of sound from the outer and middle ear to the inner ear. The common causes of conductive hearing loss are an impacted wax in the ear, or a hole in the eardrum, or chronic infections in the middle ear, or fluid in the middle ear which can occur due to allergies or large adenoids in children. Sometimes the conductive hearing loss happens due to defect in the small bones of the hearing called the ossicles. So, it can be either a discontinuity of the ossicular chain or a fixation of the one of the ossicles. An example is a disease called otosclerosis. In all these conditions, there is a loss or impaired conduction of sound from the outside to the inner ear, and this causes this conductive hearing loss. Most cases of conductive hearing loss can be treated either medically or by surgical means. In sensory neural hearing loss, as previously mentioned, the defect is mostly in the cochlea or the inner ear. Sometimes the defect can be either in the brain or in the nerve connecting the inner ear to the brain. The common conditions which can cause a sensory neural hearing loss are loud noise exposure, inner ear infections like that occurs in meningitis, aging of the patient like that occurs in a old age hearing loss, side effects of drugs used. The common medications which can cause hearing loss are aspirin and some antibiotics like streptomycin and amikacin. Head injury also can cause sensory neural hearing loss, and many times the exact cause of sensory neural hearing loss is not known, and it can be even a genetic type of transmission from the family. Due to the genetic inheritance, one can get a hearing loss. In sensory neural hearing loss, mostly the patient is treated with hearing aids. The severity of the hearing loss is characterized by the amount of decibels of hearing. We call a hearing loss mild hearing loss if the minimum amount of sound which is needed to hear is between 25 to 40 decibel. In a mild hearing loss, the patient cannot hear soft sounds and cannot follow the conversation in a noisy environment. We call a hearing loss moderate if the hearing loss is between 45 to 70 decibel. In this type of hearing loss, usually the patient needs a hearing aid to improve his hearing. If the hearing loss is more than 75 and less than 95, we call it a severe hearing loss. In a severe hearing loss, the treatment is usually hearing aids, but even with hearing aids, many of the severe hearing loss patients have difficulty in hearing due to poor speech discrimination. If the hearing loss is more than 95 decibel, we call this type of hearing loss a profound hearing loss. In a profound hearing loss, no amount of amplification of sounds is helpful. So, none of the hearing aids work in a profound hearing loss patients. These are the patients who have to communicate either by sign language or by lip reading, unless they undergo a advanced latest surgical procedure called cochlear implant surgery. Unless this is done, these patients will be forced to communicate with either sign language or lip reading. Ability has to develop to communicate with others. In adults, the hearing loss usually causes the problems with hearing, but in children, apart from the hearing loss, the children develop learning disabilities. So, if the child has a profound hearing loss, he would not develop any speech, and a total hearing loss child would completely lose ability to speak, and these are the children, we call them deaf mute. Any even minor amount of hearing losses in children can cause learning disabilities apart from hearing loss. This has to be kept in mind when treating a children with hearing loss, and any child with any learning disability or speech defects or a delayed speech should undergo a hearing test to rule out any underlying hearing problems. These children, unless they undergo this advanced surgical method called cochlear implants, they end up becoming a deaf mute child, and then the communication has to be done through either sign language or just by lip reading. The early diagnosis and treatment of hearing loss is very helpful, improving the learning of the child, and the child can become a normal child if treated in time. Thank you for listening to this presentation. Thank you.